Okay, so let's talk about magnesium. So magnesium is primarily found in the skeleton and intracellular fluid. It is the second most abundant intracellular cation. So normal serum levels are 1.5 to 2.5. It is important for intracellular metabolism, particularly in the production and use of adenosine triphosphate, ATP. It is necessary for protein and DNA synthesis within the cells, and about 1% of magnesium is in the extracellular fluid. In here, it is involved in regulating neuromuscular and cardiac function. So we can find it in our diet in things such as cereal grains, nuts, dried fruit, legumes, and then green leafy vegetables, as well as dairy products, meat, and fish. So hypermagnesemia, this is when we have too much magnesium and it's pretty rare. So we're most likely going to see it with renal failure, or if someone's just going a little crazy with the magnesium supplements. The other time we possibly see it is in pregnancy, when we are using magnesium to treat preeclampsia. So in the body, magnesium is a smooth muscle relaxer. So in preeclampsia, we use it to decrease blood pressure and prevent seizures. But magnesium depresses everything. It depresses muscles, heart, respirations. So when we're using it therapeutically, we need to monitor our patient very closely. So we're going to monitor our lab levels. If the hypermagnesemia is severe enough, it's going to cause profound respiratory depression, so our client might need to be mechanically ventilated. They also might need a pacemaker to increase their heart rate and maintain adequate cardiac output. If necessary, we might need to do dialysis just to remove the excess magnesium. With our client who has hypermagnesemia, we need to do very frequent assessments, and we're going to test their deep tendon reflexes and their muscle strength. Because it is a muscle relaxer, when our levels get high, one of the first things to go is going to be those deep tendon reflexes, and our muscles are going to be very weak. On the other hand, we have hypomagnesemia, which is the opposite, obviously not enough magnesium. I consider this to be one of two twitchy disorders. So instead of causing decreased, muscles and decreased neural impulses, it actually causes increased excitability of neurons. So this person is going to have hyperreactive reflexes. So we might see a positive Schwastik sign. This is when we tap on their facial nerve and the side of their face twitches. We also might see a positive Trousseau sign. This is if you put a blood pressure cuff on and you tighten it up and you leave it for a few minutes, it's going to cause a carpal spasm, so a hand spasm. We also can see seizures, we can see tetany, and we certainly can see some heart dysrhythmias. So with hypomagnesemia, we're going to monitor our electrolyte levels. We're going to want to do an EKG and keep them on continuous cardiac monitoring. They may need some magnesium replacement, and we can give that PO or we can give it IV. And we're going to want to limit stimuli, so we're going to maintain a quiet, dark environment as much as possible. Since their body is already overreactive, we don't want any excess stimuli.